Hello, my name is Larry Charles, and I'll be doing a video presentation for the efficiency and value of cognitive behavioral therapy. CTB is the most effective therapeutic approach. The approach is actually applicable in numerous problems. In most cases, CBT results in much impressive intended results. Insomnia, various psychotic disorders, anxiety disorders, personality disorders are some of the problems that cause for CBT. Cognitive behavioral therapy is a treatment intervention that aims at reducing the actual symptoms, improve functioning, and not forgetting disorder remission. CBT emphasizes much on the physiological behaviors as well as cognitive factors. In addition, CBT plays a big role in a disorder maintenance. Numerous surveys which have been conducted show CBT to have high levels of efficiency. For instance, during the examination of addictions and substance use disorders, high levels of efficacy were evident in CBT regarding to cannabis dependence. To add on, the various CBT techniques that were used in treating smoking sensations were much effective. The CBT techniques used greatly reduced relapse and meta-analysis involving nicotine quitters. CBT is also effective and produces superior performances while treating various problematic gambling. CBT was revealed to have beneficial effects that resulted in positive symptoms in a meta analysis that was executed to examine the level of efficiency in schizophrenia psychological treatments. During the therapeutic experiment, CBT did show up insignificant effects that are relevant to relapse as well as hospital admission while comparing it with other treatment interventions. High CBT efficacies were also revealed during a depression and dyspnea treatment intervention. For instance, the use of CBT in the treatment of depression was much effective when compared to other conditions like waiting lists. In a study that was conducted to make a comparison between CBT and other treatments that are considered to be active, including psychodynamic treatments and interpersonal psychotherapy, mixed results were actually realized from the meta analysis. For instance, it was evident that CBT is equally effective as well as efficient when compared to other distinctive psychological treatments. And other studies that were conducted did find that CBT produced more favorable results. For instance, Horn and colleagues did reveal that CBT was more superior when compared to other relaxation techniques during post treatment. A study conducted by Tolan also shows that CBT is more effective as well as superior than psychodynamic therapy. In a study that was meant to make a comparison between various medication treatments, pharmacological approaches, and CBT, all interventions did show similar effects regarding to depressive symptoms and chronic disorders. Moreover, other studies did reveal that the combination of CBT with pharmacotherapy would actually result to be more effective. Meta-analyses that were conducted to examine CBT efficiency were used as a treatment intervention for bipolar disorder shows that CBT has medium effects as post-treatment of this particular disorder. Some effects were revealed while follow-ups were done. Little evidence was therefore revealed to show that CBT is effective in the treatment of various bipolar disorders. In addition, a study that was conducted by Benin shows that CBT is somewhat effective when applied in relapse prevention in patients suffering from bipolar disorder. CBT was also found to be the first line approach that is very reliable in the treatment of patients suffering from anxiety disorders. CBT did not show positive effects in the reduction of various secondary symptoms, including sleep dysfunction and as well as anxiety sensitivity. CBT did show some promise in relieving immediate symptoms. CBT techniques that were applied in treatment of phobia did reveal equal effectiveness when compared to applied relaxation and commonly referred to as applied tensions. All the techniques did produce relatively large effects that result to long-term gains. In a study that was meant to compare the effectiveness of CBT application in post-traumatic stress disorder with the eye movement desensitization and reprocessing, did reveal that the two approaches have equal efficiency. They are both superior in the treatment of stress disorder. Additionally, a meta-analysis that was conducted to examine the applicability of the psychological interventions and their efficiencies revealed that CBT was the most effective treatment intervention when compared to psychoeducation, behavioral stress management, and cognitive therapy, just to mention a few. Uh, a meta analysis that was conducted to examine CBT efficiency efficacy were applied in various controlled treatments revealed that CBT is more superior in the treatment of somatoform disorders. For instance, CBT significantly reduces the various symptoms that associate with dysmorphic disorders. Pharmacotherapy revealed equal effectiveness when compared to CBT. Various studies that have been conducted to examine CBT effectiveness as well as efficacy in the treatment of insomnia show that CBT is more efficacy conscious when compared to other control measures. However, the relative CBT's efficacy when used as a treatment intervention for personality order was revealed to be low when compared to the psychodynamic therapy. Psychodynamic therapy approaches are the most effective while treating personal disorders, according to meta analytic reviews about anger and depression. CBT technique was revealed to be moderately effective when applied in the control as well as reduction of various anger problems. In conclusion, basing on the various studies and meta analysis regarding the application of CBT in the treatment of disorders, CBT is more effective and reveals high efficacies when compared to other treatment interventions. Thank you.